Good morning, one and all. Welcome to my poster presentation. I'm here, Dr. Sree Varshiny, Department of Homeopathic Pharmacy, PG Part 1. My poster presentation was about the cutting edge approaches in homeopathic cancer care enhanced by virtual reality technologies. Uh, to be frank, what is about cancer? As we all doctors know, what is cancer, its progression, the metastasis, the diagnosis of that. But even the unhomeopaths have known, even the layman can know about the cancer and what it is progress because of the movies and all. Now coming to the presentation, how the homeopathy will affect the cancer care. At current scenario, the leading oncologists in homeopathy, for example, Dr. Ravi Doctor, Dr. Faruk J. Master, have suggested the iscadot therapy along with homeopathic medications have given the best results in the palliative care of homeopathic cancer treatment. So, what is iscadot therapy? Iscadot therapy is nothing but an European plant that is a wisdom album. It is in the form of injection. That is the in the form of injection is was given in the form of 0.01 mg, 10 mg and 20 mg, and along with homeopathic medicine according to the pathological diagnosis of the patient, that is Asad 200, Cobalt 60, Calendula 30C, Chelidonium 30C, Q, Echinacea Q were used. In this, it is not homeopathically prepared, it is an integrative medicine, that is anthroposophical medicine. It is a scientific spiritual way, it is due to related of the holistic way of approach, but it is prepared, it is not prepared homeopathically, but it is prepared naturally by like plant kingdom, animal kingdom and mineral kingdom. So the homeopathy and anthroposophical medicines are easily go hand in hand. Coming to this article published in 2022, the therapy along with homeopathic medicines were given to the breast cancer patient and given a best results. For example, like prolonged life, that is 5 years of life expectancy, and at the same time, the general improvement of both physical and psychological studies were given. So, coming to virtual reality, how virtual reality is giving the cancer care in the palliative treatment. That is, we are support virtual reality. In this article, this was published in 2023. The virtual reality in virtual reality, 120 randomly cancer patients were assigned, and there is 4 virtual reality were given. That is participatory VR. Participatory VR is nothing but the VR will be introduced into the patient, and the participants will be the gaming will be like a roller coaster, temple run. That like the games will be implemented. In the patient was involved in the VR. Second is contemplative VR. Contemplative VR is nothing but the motivational speaker will speak in the background. That is simply so to tell it is a meditation. And third is music. In VR, the lively music will be play on. The patient will hear the music and just listen to it. Fourth is control group. Each session will be 25 to 45 minutes, and all participants after the session they'll given questionnaire. That is, the questionnaire is fully based on the to check the patient's anxiety level and how the patient's emotional strain is. So in this one, not every 120 patient have given a best results. Some of the cancer patient have thrown the VR. Some of the patient have cried in the contemplative VR, and but 80 to 90 percentage of the patient have given a best results. That is, decrease the anxiety level and the well-being was improved. So coming to the picture presentation, that is, this is a wisdom album tree. From this where the Iskara therapy was uh, prepared, and that is the another picture in which the author Henry Balde were given a biggest support for the virtual reality. The boy, despite of his leukemia, that is blood cancer, he is given two symptoms to a doctor. Despite his cancer, he have only two problems. That is, one is every day mom and dad used to fight, and my mom at last day he used to cry because I have a cancer. Second thing, my colleagues and friends always used to go for a playground and play well, but I cannot because he having cancer. Within 5 minutes he getting exhausted. So this was the mental symptom the patient have concluded this. His life expectancy was 2 to 3 years, and after that, the VR were helped in this patient. How VR is helped? For example, the VR in this situation given as an if the patient is getting an VR, for himself, his mom and dad will be very happily doing his normal mode, and at the same time, friends and colleagues were happily playing, and he also involving in that play. That was the current scenario. It is little bit clearly like a moral remedy. In according to homeopathy, Dr. Hahnemann have already said about in aphorisms footnote 17 as a moral remedy. The same exact meaning were implemented here. So, for example, we as a homeopaths we know what is moral remedy, but other peoples don't know about the moral remedy. So, what is moral remedy is, இப்போ ஒரு பேஷண்ட் வந்து கை இல்லாம ஒருத்தர் இருக்கான், அவனுக்கு வந்து எனக்கு கை இல்ல, பட் அதனால நான் ரொம்ப எனக்கு அதனால வாழ்க்கையே போச்சு அப்படின்னு நினைக்கிறான். அந்த பேஷண்ட் வந்து இன்னொரு பர்சனை வந்து ரெண்டு கையும் இல்லாத பர்சனை பார்க்கும்போது how the mentality is of that patient is the moral remedy. The same thing was implemented in this. So I've given everything in the lavender color to create an awareness of a cancer, because WHO has implemented the lavender is the shades of awareness of cancer, and at the same time this is the cancer ribbon code to create an awareness about the cancer. Conclusion and future work. Coming to the conclusion, whatever the treatments and technology have developed, prevention is better than cure. Early detection, early prevention, curative procedures, patient rehabilitation, and psychological issues on his family and real relatives have people among the worldwide is very important. And thank you for